Hi! I thought I'd do a video on frequently asked questions when it comes to eating disorders. So I got up eatingdisorderfoundation.org and they have a page on frequently asked questions. So I thought I'd just go through them, and if I have my own personal views or opinions or things that have affected me, I'll kind of talk a bit more about it. So the first question is, what are some signs of eating disorders? And they have put down excessive concern about weight and body shape, which you can't deny it is, but it's not a vanity thing. I would never do this if it was just because of weight, and I don't even like saying that I would do it because I don't believe that I even had a choice. It wasn't one day I thought, oh, I'm going to stop eating. It was very, very rooted stuff, and it's a lot more than what the stereotype of what people think of eating disorders, and it isn't a vanity thing. So yes, your brain is always constantly thinking about all your fat or about weight and size, but it's not a vanity thing, and it's a horrible feeling, constantly that defining how you're going to live that day. And yeah I hope that makes sense. um Unexpected weight loss, but some people do have eating disorders that are very hidden. I, for a very long time, maintained my weight, and that was a huge part of hiding my eating disorder, and unfortunately I didn't get help a lot, and I could have got it a lot sooner. So yes, it is a sign, but don't just look out for that, because there are other signs and symptoms. Disappearing to the bathroom after meals, secretly eating and discovering that food is missing, loss of menstrual cycle, evidence of laxative abuse, food group avoidance. So if you're avoiding carbohydrates or fatty foods and stuff like that. Skipping meals, avoiding eating in front of others, because there's a real anxiety when it comes to eating, and in your head everyone's focused on you and it's not the case, but it's just how our brains work. I'd say a very perfectionistic, when they're very, very perfectionistic about everything that they have to do, that it's it's either that way or not, that it becomes not good, and very controlling. That can usually controlling around food, and even exercise. Like people over exercise. I used to over exercise a lot, and yeah, I really don't think this made sense, but yeah. What is the difference between anorexia and bulimia? So those who suffer from anorexia nervosa restrict their calorific intake for long periods of time and deliberately starve themselves. Weight loss is achieved by avoiding food, frenzied exercise, vomiting, laxatives, and other means. An intense fear of becoming obese, as well as distorted body image, are other characteristics. Bulimia is associated with binge eating and purging. Purging can be in the form of fasting, self-induced vomiting, excessive exercise, or the use of diuretics. Sorry. Anorexia and bulimia are often present together. So my diagnosis is anorexia binge purge subtype. So I have characteristics of both, and there's a lot of shame and disgust behind them, but it's what I have to live with every day. So there are a lot more diagnoses than those two. There's EDNOS and binge eating disorder. I think they're the ones that are like, that people would know of. But there are a lot of other like subtypes and things like that. And also everyone's eating disorder is different and individual to them. And there's not a certain way that they do things, and it isn't an attractive thing, and it's not good, and it is an illness, and I don't want this to seem as eating disorders are a good thing to have, because they're not. They're horrible. They really are. What kind of medical complications can happen as a result of anorexia or bulimia? Losing the menstrual cycle, or like when they become irregular. Growth of facial hair in women, a weakening of the heart and other organs due to malnourishment, dehydration and possible impaired kidney functions, lowered resistance to infections, loss of muscle tissue, dehydration, dizziness, weakening or fainting, chest pains, shortening of breath, depression and anxiety, brittle nails and hair, sleep disturbance and fatigue, severe dental problems including loss of teeth and bone, and unfortunately death. I can vouch for a lot of them. Unfortunately I haven't had a period in a long time, which scares me because I just want to be a mummy. I'm tired all the time, I'm exhausted. I have chronic hypokalemia, which means my potassium just drops very, very quickly, and I've been hospitalised many times, and my heart is weakened, and my potassium has been where the doctors have been surprised at how that I really could have died, unfortunately, and that's the reality of an eating disorder. My teeth are terrible. I've lost a tooth. My hair used to be really thick and now it's very thin. It falls out all the time. My skin is dry. I've got pains all the time. I can't walk very far. I get really short chest and short of breath and sore, and my heart sometimes hurts. There's been times I haven't been able to walk even to the length of myself. I've fainted, I've vomited up blood. It's not nice. It's just not an attractive illness. There's so much more than the name, and I'm desperate to get out of this because I don't want to live like this. And the depression and anxiety, I can completely vouch for them, and to the point that I'm very socially anxious. I really struggle to be in big social situations, and I'm getting better because I'm forcing myself, but I don't want to live like that. What can we do to prevent eating disorders in our children? So it says here, be a good role model. Your children will have enough pressure from the media and their friends to obtain an unrealistic body weight. Try not to express dissatisfaction with your own body and weight in front of your children. Studies have shown that parents who display dissatisfaction with their bodies are more likely to have children with body image disturbances of their own. Yes, I agree with that. I also I had a very, very good upbringing, and unfortunately for me, the things that were the triggers, and were the things that where I can look back and see how my eating disorder started. They were uncontrollable events, things that I couldn't have done anything about. My parents couldn't have done anything about. There was nothing that anyone could have done. So yes, I think be open to listening to your child, communicate, and just show them that you can trust them. But and if they do show signs, just still accept them and show them that they're not just an eating disorder, that they're more than that, and try and encourage the person that they are. Yeah, that's all I have right now. I could probably say a lot more, but it says, what are the recovery rates for those with eating disorders? Approximately half of those with anorexia and bulimia have a full recovery, approximately 30% have a partial recovery, and approximately 20% have no substantial improvements in their symptoms. I can't really comment on that because at the minute I'm just starting recovery. I'm desperate to recover. I've had my eating disorder for over 10 years, and I hope I can make a full recovery, but I can't. That's statistics, and I believe that if you want it, you can get it. If you want it so much that you're going to do anything to get it, then and to live a life and to have a fruitful, colourful life, then I believe you can, like, no matter how long you've had it. So yeah. I can't really say anything else. And it says, can eating disorders cause death? Yes. The mortality rate is approximately 5.6% per decade, which is 12 times higher than the normal death rate among young women. So yeah, it can cause death. I know someone that knows, so 5 of her friends have died from an eating disorder, which isn't nice. It's scary. Like, a lot of doctors have said that I should have died because like my potassium was at a very chronic level, and it kept happening, and that's not good, and I don't want that to happen to me, and that's why I'm trying to fight for recovery, and I'm hoping that these video blogs will help me and give me motivation. So yeah, like, honestly, I am just at the start of this recovery, and I really desperately want it, but I know it's going to take time, and it's not going to be easy. It's not going to be pretty. It's going to be hard, because my eating disorder is going to fight for survival, but I need Mary to fight back, and yeah, I really want that. But yeah, I believe that if you want to recovery, then holding on to that hope, and that there's more to life than an eating disorder, I believe you can do it. I can't say that I know, because I don't know if I'm going to fully recover. I don't know anyone out there, and you don't know until you try, and you try and try and try, and yeah, that's just what I feel and believe, and I hope, because I hate the fact that anyone has to live with this horrible illness, because it's not nice. But yeah, thank you so much for listening, and I hope it helped. I don't know if it has, but yeah, Alright, thank you. Bye.